question, the member for Scarborough-Guildwood.
Thank you, Speaker. My question is to the Premier. And Speaker, I extend my heartfelt condolences to all who have lost their loved ones due to the pandemic in the past year. A year ago, I stood in this House, in this legislature, and I asked the government to close the doors on long-term care to protect our most vulnerable who are susceptible to respiratory viruses. And sadly, Speaker, there was a delay. There was slow action, and we failed our residents in long-term care in the first wave. Then we had an opportunity to make up for it in the second wave, but we did worse, and the results were devastating. A year on, we are now staring down a third wave, and people who work in long-term care are still struggling to get the supports that they need to do their jobs safely. Speaker, my question to this government is, what are you doing to improve these long-term care homes and to prepare for the third wave? I have a suggestion. How about implementing immediately paid sick days? You have $4 billion that you've put aside in contingencies. There's a budget coming up March 24th. Will you do that in that budget?
Minister of Long-Term Care.
Thank you, Speaker, and thank you to the member opposite for the question. Our government has been actively and decisively working to address the COVID-19 issue in long-term care and across Ontario. We've been doing that all along, from the very beginning, with staffing and able to hire over 8,600 staff with the pandemic pay with the first wave, and then planning with the staffing in the longer-term issue and creating the necessary staffing that was so badly neglected by the previous government to create 27,000 new positions in long-term care to get to that 4 hours of direct care per resident per day in 4 years. We've put $1.9 billion, up to $1.9 billion by 24-25 for that. And we've been renovating and redeveloping and modernizing long-term care this whole way through, not only dealing with COVID, but understanding the imperative to address the urgency of staffing and capacity and to retain staff. We will continue to do it. Thank you.
A supplementary question.
Speaker, long-term care homes in our province need resources today, not years into the future. And your $4.2 million that you announced will only allow 372 PSWs to receive their training, and they won't be ready for another 4 years. So this is not going to address the immediate concerns that we have. For Thunder Bay region alone, they need 500 PSWs and other frontline care workers to respond to the essential workers that they need in that region. There's a province-wide deficit in this area. So now is the time for your government to develop a career path that people want to aspire to in PSWs, to improve the working conditions and the standards of care, to make sure that they can work in a safe environment without risk, and to provide higher wages for these essential workers to recognize the work that they do in long-term care, so they don't have to take on 2 and 3 jobs outside of long-term care. So, Speaker, will this government, in the upcoming budget, invest in personal support workers and the money required for long-term care?
Thank you very much. Again, the Minister of Long-Term Care.
Thank you, Speaker, and thank you for the question. For anyone who's been listening for many, many months now, they will understand that our government has been working diligently to address the long-term staffing crises in the long-term care sector and the emergency response. So the pandemic pay, $4 an hour increase for PSWs, $461 million for that. On top of that, the temporary wage increase, a $3 per hour increase for that, a $1.38 billion expenditure across the sector, the 8,600 people that we were able to hire into long-term care with the resources we had in the first wave. Added to that, 8,200 PSWs alone to be trained in the next coming months to be ready for the fall. Billions of dollars have gone towards staffing and COVID-19 support, and we've been at this the whole time. Where have you been?